So the real question is there something more than about emotions when we talk about heart health? And to throw light on this subject, today we have dietitian Mansi Patil with us, who is a skilled dietitian in clinical nutrition, who is also a member of International Society of Hypertension and National Executive member of IAPN India Association. So, on behalf of BestSource Nutrition, Dietitian Mansi, I welcome you to have this chat and want to thank you to sparing time for us to discuss on this very relevant subject of heart health today. So, my first question to you is heart health only about older people?
I think, Dipali, that's a fantastic question, um, which is a huge myth that we've had till now. So, a very simple, straightforward answer is that no, heart health is not just about older adults. Um, Even heart disease is not just about older adults. Age, yes, is a major risk factor for cardiovascular diseases. Um, but in the past few years, we've seen a major rise in the cardiac events in a younger population as well. Uh, what we've seen, if we come from an evidence perspective, if we see that, we've seen that the plaque formation or atherosclerosis basically starts at a younger age, in childhood, adolescence, and there are multiple autopsies for children that have been done which have demonstrated this. There is a rising rate of diabetes, obesity, diabetes. I mean, we are the diabetes capital of India, so of the world. So absolutely, I mean, goes unsaid that heart health is not just a disease of the elderly. It is something that we will have to start shifting our focus to a younger adult. And so heart disease or heart health becomes a lifelong process. It's about prevention, which needs to start early and ideally in childhood.
Right. So the major reason could be the stress. So how stress silently affects the heart condition?
I think that's again a beautiful question because one, we somewhere land up when we use the word stress, we land up thinking only about the psychological stress. We forget the aspect of physical stress. But either physical or psychological, both of them are very powerful predictors for cardiovascular risk. Uh, Again, from a biological perspective, if you see, we are looking at sympathetic activation, we are looking at increased cortisol levels, which is a huge challenge even in a younger generation. When they are stressed, let's say they have exams or whatever kind of stress they go through these days, the cortisol levels would increase. There's an inflammatory activation that happens within the body, endothelial dysfunctions, and the prothrombotic state is increased. So, in the bargain, what happens is we are looking at an elevated heart rate, elevated blood pressure levels, insulin resistance, central obesity, vascular injury, the plaque formation is there. There is plaque instability that comes into picture. The vessel dilatation doesn't happen appropriately, and there is a risk for clot formation. So you can go back to studies like the interheart studies, which talk about chronic psychological stress as well as physical stress uh, becoming a potent risk factor for cardiovascular diseases.
Right. Normally, what happens when we talk about heart, we only focus on the cholesterol part. That if your cholesterol is imbalanced, that means your heart health needs attention. But do
True.
you think that cholesterol is the only villain when we talk about heart?
Oh, that's an interesting question because yes, cholesterol somewhere is very strongly related to the cardiac risk, but cardiac risk in itself is a cumulative factor. So it is multifactorial, be it genetics, epidemiological, it is be it the medical factors like we discussed, stress. It is all of this working together. So apart from cholesterol, we would also need to look at the medical state of the person. Let's say hypertension, diabetes, insulin resistance, chronic inflammation, lifestyle factors like smoking or tobacco exposure or sleep irregularities, physical inactivities. Um, we could also talk about environmental factors like air pollution. But if you're looking at just measuring blood, something from the blood, as in if you're looking at blood tests, then probably apart from cholesterol, let's go a little deeper and not look only at total cholesterol. Look at HDL, LDL, look at the HDL, LDL, and the triglyceride ratios. Look at lipoprotein A or ApoB levels as well. Um, so if we focus solely on cholesterol, the chances of us ignoring the broader aspect of metabolic syndrome, I mean, all of this does fall under that, uh, will become more, it'll become stronger for us. So we will need to start talking about everything together simultaneously.
Right. So having a holistic approach is the best way. So as a dietitian, what nutrition approach you take when when you do dealing with only, let's say, let's start with cholesterol when we are talking about heart health for the benefit of everyone to
Mhm.
look, I do not want to oversimplify the things to cholesterol, but let's start with the cholesterol and then how the nutritional approach go further with other aspects of heart health.
I guess the key word here being holistic. So, cholesterol, yes, but like you said, we'll probably talk about everything. And from a diet perspective, it becomes more of dietary patterns that a person has. So, we would try and nudge a person towards a more cardioprotective dietary pattern. So, traditionally, we talk about a Mediterranean diet, or we start talking about DASH diets, which are, from an Indian perspective, you'll have to customize them for the Indian population, where, uh, again, to make it very simple, we will need to emphasize the intake of vegetables, fruits, whole grains, legumes, nuts, a shift from saturated to unsaturated fats, limiting the ultra processed foods that are there, refined sugars, excessive sodium, moderating the protein sizes, the portion sizes becomes extremely important. Um, but beyond that, physical activity is important, sleep regulation is important, stress management is important. Um, Consumption of a lot of berries and the fruits that are there will aid in the antioxidant levels that are there. So all of this together is what a dietary prescription typically would look like.
And do you take help of
Sorry.
any supplements or herbal teas where it, have this diet approach to
Sorry.
the heart health?
Mm, So, yes, there are a set of patients where uh, supplements become helpful. So, I mean, if you look at, we are talking about cholesterol. So, if you look at beta sitosterol, you would find that it is pretty helpful in the cholesterol management along with omega 3. So sorry. I'm so sorry about that. So beta sitosterol is something that I have used, and the way it works is that it would compete for with cholesterol for its absorption, and therefore it will help in the reduction of LDL cholesterol. So that's something. Again, a very focused approach that I usually keep. So when I'm looking especially for non-pharmacological reduction of LDL, as in I'm not looking at the medication perspective, but a supplement, then sitosterol comes into picture. As far as omega-3 goes, I'd say it reduces the total triglyceride by almost about 20 to 30% when given in the right dose and for the right set of patients. So those are supplements that are helpful. Um, Herbal teas are not something that I've tried much, but these two, I would say, if you're looking at cardiac health, yes, but let's say if this patient shifts to somewhere around cardiac failure, then you start talking about CoQ10 and stuff.
Right, right. So, coming back to the stress being the factor of, should be looked at, what are the signs when person can make out that your heart is under stress?
I think that is very individualized with respect to how a body responds to stress. Now, it could be as simple as someone, let's say, was a very talkative person, just stops talking, right? Or that social interaction starts going down. Or it could be on the other end of the spectrum where there is shortness of breath, palpitations, sleep disturbances, frequent headaches, or variation in the blood pressure readings. The heart rate is again varying. They are generally we look at the resting heart rate as well, or persistent fatigue is seen. There could also be some set of patients also have chest pain, which is non-anginal. So yes, I mean it's a huge spectrum of signs and symptoms that come up, and it varies from one person to the other. So it is more about mindfulness, about a person trying to identify and trying to figure out where is the stress reflected for each person.
Right. And when we talk about, managing the stress, which is all affecting the heart health, what should be the nutrition approach?
Um, when you're talking about heart health and when you're looking at managing stress from that perspective, um, I would say one, let us not combine just these two together. It'll be a whole gambit that you have with you, not just heart and stress. So let's maybe talk about stress because stress itself will end up affecting all the other organs of the body and all other aspects of how the body works. Now, for managing stress, uh, I think these are small daily habits that need to be inculcated in a person's life, be it regular physical activity, uh, be it listening to music, picking up a hobby, be it eating healthy consistently. So I've always told my patients that diet is not about 3 weeks or 6 weeks. It is what you have thrice a day all through your life. So whenever we prescribe a diet, it's not just for those 6 weeks. It is something that is lifelong. So having a healthy diet consistently, regularly becomes important. Sleeping is important, right time, right duration. We can't say that I need just 3 hours of sleep, so 12 to 3 is what I'll sleep. Your body needs time to recover. Apart from that, yes, your like I said, hobbies is something that you will need to have because the creative part of your mind has to be engaged. It is ultimately your brain which is sending out signals. So we need to overcome it. We need to keep your brain engaged and rejuvenated. Uh, I think those are some things that we will need to do. And yes, mindfulness comes into picture in absolutely everything. Managing emotions is important. Stress relieving could also be, let's say, something like massage. It could also be there's something called as binaural music that you get. So if you put up a headphone, both the speakers will have a different music that comes out. So they're very scientific basis to it, which helps in relaxing the mind.
Right. So what I understood is that uh, because of the stress, the cortisol level, disturbs, and because of the stress, inflammation happens, and all these ultimately affect heart. So just it's just not cholesterol which needs to be looked at. There are the other things also. Uh, the bigger picture which we need to look at when we are talking about heart health or managing a heart disease. So, from the
Absolutely.
diet perspective, that what are the things which you understand should be included for managing this, to control the cortisol levels or manage the inflammation. So ultimately, your heart is protected.
Mm, okay, so to get it all into a small capsule, if that is what you want, let's start with diet. That's what my domain is. Um, have a variety of foods. Not restrict yourself to certain fruits and vegetables. So have a variety of fruits and vegetables. Have at least 4 servings of fruits and 4 servings of vegetables, which is a huge task, but that is what our ask is. Um, have whole grains, which is uh, uh which is non-negotiable. All refined flours, sugars, all are out. Those are the factors which will help in reduction the chronic inflammation that we have gone into. um, Take the help of functional foods, take the help of supplements if that is required, that is advised and prescribed. Look at the stress levels and how you manage it and not bottle it up. Uh, have a vent for physical and emotional stress. Regular physical activity, again, is non negotiable. And I think have a happy environment all over around you.
So, which is what is one thing which you wanted to highlight, that this one thing the people should change in their lifestyle, that one thing can have a long term protection towards your heart health.
I would say it's the thought process that this is a lifestyle approach and this is not for achieving short-term goals. I mean, we are not looking at achieving 10 kgs weight loss and it ends there. It is a lifestyle approach. Whatever support you require, whatever interventions are there, it is a thought process that needs to change. And that is the core to all of this, is what I feel. Once you change your thought process, you know what you need to do throughout life.
So I will take an advantage of taking personal feedback of yours towards BestSource Nutrition. I know that you have tried omega-3 fish oil, BestSource Nutrition, and beta cyclosterol earlier, and there are many other products also which could be of use to you, like hibiscus tea for hypertension and grapeseed extract, which helps in managing blood circulation. But what has been your feedback so far with BestSource Nutrition as a brand and products?
Um, I think at the outset, I'll say kudos to you for coming up with such innovative products. Something that was the need of the day and a huge gap that we had in the market. Uh, the two products that I've used, they have been pretty effective for quite a few of my patients. And like I said, triglycerides and LDL, those were the two areas that I worked with on for my patients. And it's been helpful because they've been able to manage it without any other pharmacological intervention. So, so hats off to you. Kudos.
Thank you so much. I mean, that's a encouraging feedback that we keep on, trying to come up with innovative product for useful dietetics practice, and we also want to have suggestions from you. And I want to thank you, Dr. Mansi, for taking out time for discussing on such an important, relevant topic of heart health today. And thank you once again.
Thank you. It's been a pleasure being here.